I'm Ann McDuff, and I'm the Assistant Director for Community and Public Health. And in detail, that really means that I have responsibility for disabled children's services, children and adolescent mental health, and the public health sector of our services. And again, for the public health sector, that really involves school nurses, health visitors, sexual health, family planning, and gum clinics. Too long. No, I've enjoyed every minute of it. So far I've clocked up about 29 years here in the Western Trust area, but previous to that I had a couple of years when I worked in the Southern Health and Social Service Board. There's really no typical day, and I suppose that's what I enjoy about it. Most mornings I start off quite early. I usually come in here about 8, 8:15, and I start with emails because there's always a backlog. And there's the correspondence and all of that. But primarily what I'm enthusiastic about is looking at the services for the children and the families that we serve, making sure that they're of a good quality, making sure that there's a developmental aspect to all of those services, that we're constantly looking at how to improve, how to involve service users, how to work in partnerships with others, such as the voluntary community and sometimes private sector. And I suppose most of my service areas involve a high element of multidisciplinary work, which again is very exciting, and they all bring an added dimension to the service. I enjoy the variety of my job. There's no typical day, as I said, where you're trying to plan and make sure that services are appropriate, accessible, and of a good standard. There's always those challenges every day that come in, kind of left side, that you're unexpecting, and you just have to respond and work with your colleagues and your staff, which is obviously your most valuable resource, in resolving the problems, finding solutions, and moving on.